Manx Care's mission is to become the best small island health and social care system in the world, but can we really have the world's best service without draining precious resources from the rest of Isle of Man government? The Minister joins me now in the studio to discuss this and many other health-related matters. What's your proudest achievement? Let's start with a positive since being made Minister.
Thanks, Phil. I think that there's obviously a couple of areas which I would say, first of all, one of the areas in terms of that would really affect, I think, the public was the dental waiting list. And we took steps with Manx Care to increase the UDAs and invest in that to reduce that dental waiting list down. I think that really sort of steps to the fact that what I wanted to do was come in and really listen immediately to what the public were saying, and these were quite huge frustrations. And of course, we've managed to reduce that initial waiting list, but of course, people are moving from the private to the NHS, and so that waiting list now still needs to be worked on. But the initial waiting list we immediately got removed. I think one of the things that we don't talk about are internally, so being in the department and building the relationship between the frontline staff and the department. I'm really proud of that because that is about rolling your sleeves up, Phil, and whilst we do have an arm's length organisation, that was never set up to remove that relationship between the DHSC and the frontline staff, in my opinion. And that's been a real pleasure to work with them.
Because, of course, when you came in, I mean, you were coming in to replace a minister who's probably has the record of being the shortest lived minister in a particular role, and this was coming in not that long on the back of the whole Rosalind Ranson affair and all of those issues. So there must have been a fair amount of anxiety, to say the least, amongst the senior staff in the department.
Yeah, I think it's fair to say that we're still living with ramifications of the Rosalind Ranson case, and that was very important for me to reset that culture within the department. And again, I not just the department, but as I say, with Manx Care colleagues and the frontline staff, it is really important to have a very good basis of listening. And it's really important that from me as a minister to say at the top I'm the one that's accountable, and to take that pressure away from them and say, come to me with your issues, come to me with the problems, because only then can we solve those together, and not be frightened about speaking up and not be frightened about saying that something or somebody might need to improve or something like that. And that was the background that I came from. So I came from a really good cultural background whereby the person in the most senior level really took that accountability. And I think that's what the public expect. Whilst Manx Care was set up to create an arm's length organisation, and it has absolutely removed that operational involvement for the DHSC. As I said, I think that the Manx public and certainly politicians over these years have given it the chance, but I think that you can't remove, because we live in a very small jurisdiction, is you can't remove that factor that we are very accessible, and we should be, but we are the people who are accountable. The MHKs and the ministers are accountable. So it's not just me, but also the wider Tynwald are accountable as well.
And it does make sense, doesn't it, that politicians shouldn't be able to, what you should be able to do is create schemes that remove significant waiting lists. What you shouldn't be able to do is say, Mr. So-and-so is one of my constituents, can you bump him up to the top of the list? And to a certain extent, that was the idea about that separation of power. So it was down to Manx Care and the doctors to decide on medical priorities. It was for you as minister and your colleagues in the department to basically say these are our overall priorities and this is how much money you're going to get. And that's what that separation really means, isn't it?
Yeah, and you're right. You've hit the nail on the head there, Phil. So the way that it's set up is obviously we set the mandate, and that says these are the operational. We need you to provide these services operationally. There is absolutely no way that politicians should be involved in the decisions, clinical decisions at all, and who gets a preference on a waiting list. Excuse me, and that I think has been very successful in terms of the Manx Care setup. But I think, as I said, the public still, when it means something to them, and it obviously means something very much to me. I haven't got an appointment, or I've been waiting, or I can't get through to X consultant, or I haven't really got the service that I believe I should be getting. We are still accountable for that, because whilst Manx Care deliver the services, we're the ones who say, this is the service we require you to do, and we need to hold them to account to make sure that they are delivering that service that we require. It's still, Manx Care is still in a very, it's an infant in its inception. You think of the police and you think of the fire service, just as good examples of years and years of embedded separation of operational and political decisions, etc. Manx Care is still very much in that very, very early stage. But I think what we have to do, and that's part of the governance review, and I'll talk a little bit more about that later, but what the governance review is basically saying, yes, that separation should exist, but actually the department and the government need to make sure, we almost need to hold their hand as we walk through the years of us being able to become like of the fire service and the police service, where it really does have that wholesome separation.
Because this is a big cultural change, not just internally for the officers in the department, officers in Manx Care, but it's a cultural change across the island too, of understanding that separation. It is fair to say that Manx Care has success, because there have been some great successes, but equally you will be hearing, as indeed Manx Radio and everyone gets to hear of the cases which have been less successful. People will look at the substantial amounts of money that have been pumped into Manx Care in the last 5 years and say, you've had these huge increases in budget. How is it that some of these basic things are still not working? And I suppose that's the question. Is Manx Care working, or do we still need to give it more time, or should we actually say, you know what, it was a great idea, but it's just not effective?
I think that the conclusion that I'm certainly drawing to is that Manx Care 2.0 is around the corner, and that's what we have to focus on. What that looks like will need more involvement of Tynwald.
So basically, sorry to butt in, but basically I guess what you're saying there is Manx Care 1.0 isn't as effective as it should be.
I think that, so I would say that it needs to be improved. With all best intention, you can set things up. Even just when I look at the Manx Care Act, there are certain things in the Manx Care Act that I would, just even technical things that need to be improved on. So it's not necessarily saying that they haven't done well. They've certainly done the job that they were asked to do, or have been asked to do. But we can improve, and we all must agree on that absolutely improvements can and should. We should constantly be reviewing this and making the improvements. But you just hit something really important there, Phil, where you talked about money and budgets, and that is fundamentally, that brings us back around to accountability again, doesn't it? Because the way that it is set up is that the financial accountability lies with the department, and yet we aren't responsible for how that necessarily, what we say, we want you to deliver these services, but internally we don't have eyes on the actual finite detail of that financial accounting. So the governance review is it's looking at these sort of areas, and I take finance as a really important
and this
one.
governance review was established Well, you tell me.
Governance review was established, I think, just as I came in, just the Chief Minister had set it up as the acting minister. But yes, it basically is trying to draw the lines together to be able to, the MIA governance review assessed that basically there were areas within this organisation, within this structure, that weren't working as well as they could. So I'll take finance as the perfect example. So you have a finance director, and within Manx Care, you don't have a finance director in DHSC. You have your business, your finance business partner who reports to Treasury, working for the DHSC, but reports to Treasury. And then on top of that, you have the financial accounting services, so your accountants, again, working in Treasury, but second to Manx Care in a sort of a dotted line way. And so this structure is in 3 places, Phil, and that doesn't, work. It really doesn't work. So we're taking that initially because we can't get into the detail as the department, but yet we're the responsible ones, and we've got the pressure from Treasury saying and the public quite rightly, you need to come in on budget. So we're looking at now drawing those areas together, having the finance director dotted line to DHSC, but Manx Care, but they would all sit with each other. Even just sitting in the same room, Phil, will make a big difference. But having all of these areas sitting together, so there's one version of the truth, because at the moment you have a version that Manx Care talk about, quite rightly. You have a version that the DHSC look at, quite rightly, and then you've got the Treasury version. We need one version of that truth, of that financial accounting. And I think for me, when I took responsibility as minister, I found it immediately difficult to be responsible for an area that I couldn't even see. I couldn't even physically look at that finite detail, and was getting absolutely the assurance from Manx Care, but I didn't have that person reporting directly to me, and I think that's where this restructure, this one finance team, that will really benefit everybody. So that's coming into place because when we went, going back to the governance review, we debated that in February. I think it was in February, and it was agreed within Tynwald then that we would do the fundamentals, and one of the fundamentals was about streamlining processes and things like that, and drawing together the working conditions. So taking finance, that's the first one. The other one is also comms. So again, we had a couple in comms in Manx Care. We had central services within the Isle of Man government, but not actually a comms person in the DHSC. And yet we're the people that are expected in the Manx Care Act to inform everybody and to tell them what's going on.
Ultimately,
and
you're accountable.
Again, So it's picking those areas up and saying, I would like those areas to sit together urgently, so that we can again have one voice, speak about the same message, and be more proactive. You talked about good stories when we started this interview. It's about being more proactive, about actually telling the public this is what we're doing, and being better at that, Phil, and saying how we're delivering that mandate. That's the core
of course,
thing.
I suppose the difficulty that you face, and indeed all ministers, I've been there and I know all about this, if you do what you're expected to do, which is deliver a really good service, people will say, well, of course you should be delivering a really good service. It's when that service doesn't deliver what people want, that's when people say, well, actually, look at this terrible tragic tale. And there are lots of tragic tales, sadly, of things that have gone wrong. And that's what people tend to focus on. That must be quite difficult as a minister to get your head round. How can you, on the one hand, tell the positive stories without undermining the condition of the negative ones?
And I've always approached that with extreme empathy. That when people do come to you with a situation that we and I say we, but Manx Care operationally haven't delivered. it's really important that we listen to that, and it's really important that we make sure that that doesn't happen again. We aren't perfect, and I will absolutely put my hand on my heart and say there's things that we can do a lot better. And I think it's important. We talk about comms. It is about informing the public and being more transparent. What does transparent mean? Okay, so I can talk to you about even coming in the 5th year or 4th year of this administration, and just saying, what do you as a patient expect to receive in the hospital? Well, where is that information, Phil? It's nowhere. And they have policies, they're all kind of agreed internally, etc. But there's nothing public facing to say you can this is what you should expect in the ward, this is what you can expect in terms of a turnaround time. And so it's taking those policies now, over the last sort of 6 months, this has become quite an apparent thing, and saying, well, this is what we should be putting out there. We've got some 500 to 600 policies within Manx Care, because obviously they are very operational. But it's picking out those ones and going, these affect the public the most. This is what you should expect. If you're on medicinal, with this subject came up, if you're on medicinal cannabis, can you take that in hospital? It should be really easy for somebody to get that information and understand that, and not be nervous or scared or worried about that, because that's really, really important. So it's taking those things and going, come on, let's get that out. And a lot of that is driven by, we've not got great in terms of support from IT. Again, that's another central services. I'm very much, can I have my IT back? Can I have get it away from, can we be a bit of a lone department here that changes the wheel? Because actually we are the biggest department, the biggest budget, and actually we need these services, I think, within us to be able to get the Manx Care record done, to be able to have a fantastic website that should update, that should absolutely inform the public. And then, I was talking to a colleague the other day, when you hear the word patient transfer, I'm a layman and at heart, and I think patient transfer, just that, you would automatically think that means from the minute you leave your house all the way to you arriving into the hospital and back. And yet the service itself really only does a little part of that. You're expected to go and book your own hotel. You're expected to, in some cases, to go and book a taxi if it's out of the certain locations, and you're expected to claim that back, and you're all of these things. So even in the title patient transfer, it's kind of the wrong label for that service, isn't it? But yet it's what we've used for the last however many years. But again, I think the public expectation, if we can really make it far clearer of what the public should expect, and this is what it costs, and for them to understand that we don't have an open checkbook, we don't have the ability to be able to pay for absolutely everything. Within reason, there should be allowances. And those who are obviously on the lower income scale, we should absolutely be supporting. But it's really important, that expectation. And I think that's where the bad stories come out of, because they'll experience that and they'll feel on their own. I mean, before I was minister, I remember hearing stories about them not being able to get in contact with patient transfer. They were left on their own on bank holiday weekends. Or there's numbers, but if you don't know that, if you're travelling, you're sick or you're unwell or these are the things that are really difficult.
And of course, I suppose what you're saying is that negative communication or the negative experience could be at least mitigated if everyone knew this is what you signed up to. This is what your national insurance payments are actually delivering. This is what your taxes are delivering. This is the policy.
This is what we can provide, and this is what we do provide, and you will get this service. And I think that needs to be a lot clearer. And I think because of my background, I think I'm very much, I call them, obviously it's patients, but it's consumer information, isn't it? It's basically really being hot on that and being able to sort of give that information to them.
You did say earlier about people's, well, they shouldn't believe that you have an open checkbook. And yet, I suppose the elephant in the room in this conversation is, in a few weeks' time, Tynwald will be considering yet another overspend in or underfund, depending on which side of that argument you wish to sit. But £20 million, 19 million revenue and another million capital that wasn't authorised in last year's the 2025 budget. When you were appointed, the Chief Minister made some very strong statements about the unacceptability of these things, that overspends would not be accepted in the future. We know that there's been a huge increase in the DHSC budget, ultimately the Manx Care budget, in this administration. And I think people kind of expected when you were appointed that would be the end of overspends. I mean, I don't want you to rehearse all the arguments that you'll be employing in Tynwald in a few weeks' time, but what has gone wrong, and how fundamentally are we going to be able to accept your word, because I'm sure you're going to tell me this, that there won't be overspends next year?
So I think you're absolutely right. I think when I certainly came into this post, I came in and sort of halfway through a mandate. It had already sort of been established. In the mandate, in the operating plan, the department and Manx Care were very clear about the operational factors that were outside of that budget, even at that point. And we were very, very clear that there were pressures externally to Manx Care. So whilst we say we're mandating these areas, there were areas out with that, and those came from obviously drug cost pressures, inflationary costs, staffing costs. These were areas that were highlighted right at the beginning, and those were risks at that point, and those risks transpire throughout the rest of the year. And we obviously have come to the end of that year now, and without saying that we didn't necessarily take the decision to reduce services or cut back in any way during that year to offset those costs, it was certainly a decision that we, because we'd had highlighted that at the beginning, that we felt that we would be coming back, and obviously Tynwald would understand that we said these were going to be risks, and they transpired as risks. Going forward into the next administration, it will be the next administration, but it is this next year. But going forward for that, we have had a substantial increase in the budget. That was something that I really fought for with in bringing the council ministers along with me to give the budget that Manx Care should be able to deliver on. And we were really explicit in this situation where we weren't going to, in this future year, where we weren't going to have anything within that mandate. So in the 25-26 mandate, we're going to provide this, but it's a risk because we haven't got that funding yet. And that might be through transformation, or it might be through different legislative changes. But yet this mandate, what we've done is gone in a very different way and said, this budget will deliver this mandate. That is it. And if there is something later on that we want to bring in, a service like, for example, ADHD for adults, a diagnosis service and pathway, if we want to bring something like that in, we must go to Treasury during the year and put in a business case for that money, and it must come to Tynwald in a very, very different way, because I think then the public can understand that process far better within the middle of the year, or and we don't oversell ourselves in that respect.
Because of course, other departments of government, all the departments of government have budgets, and they will undoubtedly be saying to Treasury, look, there's a significant risk that if you only give us this amount of money, I don't know, if it's DOI, they'll say that the roads infrastructure is going to fail, or if it's let's even go down as far as Manx National Heritage. They will say if we don't get a substantial uplift in our capital budgets, our guardianship of important historic buildings is going to suffer, and these are the consequences. All the departments of government will have said these things. The difference is, if at the end of the year they're overspent, they just can't do overspends. They don't overspend.
Well, some of them have obviously in the years, but when you've got the biggest budget, relative, I know DHA had in the last year, and I'm trying to think which other ones.
I think DOI did last year.
DOI did, and so obviously if you have the biggest budget, it will seem a lot more, but in terms of the percentage, it's probably very similar. But what I would say is we also have 3,000 employees within Manx Care and across our health and social care services. So again, we are open to external pressures. Obviously, inflation. With 3,000 employees, we're open to pay awards happening in the UK that we are, under some pressure to mirror that same service in the UK. So you can understand when those things are happening in year. You can't predict that. We are going through exactly the same thing here now in this year. We haven't agreed our pay awards with some of the areas within Manx Care. And that, you've got doctor strikes happening in the UK. They can't agree on they're asking, I think, something like 8 or 9%. That's totally not what's been budgeted within our budget at the beginning of this year. So we've got to be really cognizant of that. But it comes back to communication and explaining that to the Manx public and saying, we think that our staff should have this amount, and we think that's something that should be
to a certain
more
extent
within the budget.
I suppose you're operating in the confines of financial regulations and the government processes, which basically say that if you do overspend, you need to come to Tynwald with a report at the end of the year, because the assumption is that if you know you're going to overspend, you'll do something to stop it before you do. And I can see both sides of this one. I mean, what you're suggesting is that you recognise that you can live within your budget unless something comes along during the year.
Yeah.
And if that thing happens during the year, you go to Tynwald and say, look, this is what's happening. Will you give us the money or not? And I suppose the difference between what you do and, say, what... let's use the Department of Infrastructure, because it's the third biggest budget, I think, in government. DOI will know that if it just stops doing certain things like road schemes or whatever, then it can come within budget. In the sense
that it's not lives, is it?
Yeah,
is it, Phil? So I mean, I think that's where you have a far harder moral decision to make. As a minister, I think it's really more difficult because it could affect, if you start to slow down a service to pay for an additional expenditure that's outside of your original budget. That's a really difficult decision, and then that comes down to the whole politicians being involved in those kind of decisions. Yeah. We come back in full circle to that,
and you can save the millions in an annual budget, but ultimately by making a saving which is, say, cutting the number of operations that take place at the hospital, you then develop a large waiting list, which then requires a waiting list initiative, which is going to cost money then in the next year.
Absolutely. I think so. We have also, since I've been minister, we've also introduced what's called a financial recovery programme. And this is looking at a 3 to 5 year financial recovery. So this has been really fundamentally important for me. I was talked about being able to see where the money's being spent. So we have this team that are part of this finance team that I talked about, who are literally looking at where we can possibly pull levers to be able to make some savings across the organisation. And that can be just organisational ones. That's not necessarily slowing down a procedure. And that's where we really need to get that visibility to be able to say, okay, these are the things that we would be more comfortable with. And I can't say what those are right now because that piece of work is happening, but I certainly want to be able to communicate that, and when that starts to come to fruition and we have that visibility, so that the Manx public can see. And this just, and I hear it so much, that I want the Manx public to be able to see, we've made efficiencies in this, and this, but yet we've still got that. And it would have been a risk to us at that cost, but we've managed to mitigate it by at least half or something like that. And the Manx public might then be a little bit more, okay, well, we can see that you're making efficiencies and working hard to do that. We understand that, as you call it, and everybody else will call it, that overspend is justified. I call it a structural deficit, but it's an overspend, isn't it? Because at the end of the day, we've gone over our budget. So I think this is where we've just got to get better. But this also comes back to the budget system that we have. When you work in the private sector, a budget is your forecast. Basically, this is the explanation of what we aim, whether it be sales or revenue. This is what we're aiming for, and this is our costs, etc. And in the private sector, that is variable. You might not have as good a cost of sales as you anticipated and things like that. It is absolutely very similar within the Isle of Man government, but it's so much more obviously transparent to the actual public because it's the public's money, and that's where the difficulties
and I
lie.
suppose again part of the problem is in a private business, you have a few shareholders and you are responsible to those shareholders. In the Isle of Man, you have 83, 84, maybe 85,000, depending on which of the figures you would believe, people, all of whom have a vested interest in the health service being delivered well. And certainly the last interview I did with Teresa Cope, she said quite clearly, Teresa Cope, CEO of Manx Care, in case anyone doesn't know, she said very clearly that the experience of social media in the Isle of Man is probably the worst that she has encountered in terms of the negativity that comes. I mean, obviously there will be some positive stuff there too, but that was something that she particularly commented on to me. This does put officers off from engaging, because the more you engage is the more likely you will attract the negative and nasty comment from the public. I mean, is that hindering some of this explanation, do you think?
It's a really good question. I think social media has a really good, valuable part to play in how we can improve. I genuinely believe that. And I think that, certainly whenever I've seen social media that's directed about services, I've tended to not challenge that publicly because I just think there's just no point. You want to help people, not challenge. And so I've always private messaged if I've seen it or someone's tagged me to sort of say, look, how can I help? And obviously it doesn't always go through because some people have different settings on their Facebook. So I do think it has a really powerful way of bringing things to light and an urgency that is sometimes life-changing. And I really value that because I get on with my day-to-day job and I'm not there looking at my social media, but sometimes it's been really helpful for somebody to go, this isn't right, and actually, can you help and sort that out? And I think that has been really, really key in getting things better. But I can understand, and when I talk to professionals within Manx Care, and I don't just mean the executive, I mean our consultants and our nurses, I see the effect that has on them. And that's where I take that accountability, and I am, I find that because they're working extremely hard, and that's where I want to sort of protect them and say, this is just an isolated scenario, because I'd get hundreds of really good positive comments and stories and letters, and actually these are really good. And I try and whenever I get a lovely letter from about a ward in the service, I make sure I write to that ward to let them know, because that's so important for morale and so important for them to hear that. But as I said, I think social media has a role to play here. But in the first instance, I would always say, please, try MCALs first of all. Remember again,
MCALs.
And well, yeah, again, this is something that we've not been very good at sort of saying, what does MCALs do? So MCALS, the abbreviation is Manx Care Advice Liaison Service. So it is a liaison service. It is not a complaints service. So when somebody says, I've written to Manx Care and I've complained, they won't take that through the complaints process unless you request that and say, I want this to be formalised as a complaint. And the complaint process is different. That is, Manx Care will do an internal complaint. They will review it. There will be an address in terms of to that patient, in terms of whether something needs to change, or whether they did something wrong, etc., or whether it's adhered to or upheld. And then if that's not satisfied, then it goes to the healthcare services or ombudsman. So there's a whole process separate. But MCALS, the Manx Care Advice Liaison Service, is there for if I've been waiting for a letter from the consultant and I've not heard, or my GP said that they were looking for the scans that my consultant said they were sending and they've not. Contact them first, because they are this like one sort of stop shop where they can go to all these different areas and do that liaison for you and be able to sort of find that information. And I do see a lot of people getting their answers back within 24 hours, and it is a really, really good service. But I think, again, this is about the public's perception. Just remember that isn't a complaint service. And if you do want to make it a complaint, you can still use them to say, can you make this a complaint, please, for me? And I wish to do that. And they will help you to do it. But it's not a complaint service in that sense, that they're not the ones that will investigate in any way. So I think that this helps to be able to communicate that, Phil. So I appreciate that.
One of the things, again, we've not referred to is the general disgruntlement that there appears to be about the way Manx Care operates from internally. So we have doctors. Now, I don't know, are they playing politics, would you say, or do they have genuine concerns about the way in which Manx Care operates? Or maybe both? I
think that there's some truth in both. I think that certainly the consultants and doctors and the medics that I have spoken to, it has always been, the main concern has always been about patients and about being able to do their jobs. And I always say that I have the best job in the world to being able to facilitate that for them. If I can do that, I'll do it. And so I genuinely believe there's a genuine concern. I think that there has been a great deal of change. And, the Sir Jonathan, I sigh at that, mentioning that again, but Sir Jonathan Michael's report identified that we needed to modernise our healthcare services, and that has been quite a big change in these last 5 years, that whole transformation programme, and changing the way that we work, but bringing those people along with us. If you don't feel it's never going to work, and that's where we've got to be really good at bringing people along with us. And I don't necessarily think that. All right, let's say it, put it another way. I definitely think there's another area for improvement, and I am spearheading that as much as I can to try and do that. Take, for example, the rapid bed review, which I received on Friday. So we hit our deadline the end of the month. We've got it on Friday. The department's now reviewing that. We'll come to our department meeting on the 10th of June. And we will be working with Manx Care to come up with a plan now to address the recommendations within that review. And that, why did we do that? Because a lot of people are sort of, you just have to listen to the consultants, we tell you, or you just have to listen to Manx Care. When you've got something that's really important, is because it isn't just a bed review. We called it that, but it's not just about that. It is about the whole service. So when you're getting your appointment at a GP, if you can't get your GP appointment, you turn up in A&E, and that's affecting the whole flow. And again, when you're wanting to be discharged, if you can't go to the care home or you can't get back home because the facility, even your own home isn't the right sort of situation, that's blocking the beds at the other end. So it's that whole sort of patient flow. And I know, was speaking to the guy who did the report, Peter. He has worked in I think it was the Orkney Islands and different. He's looked at different hospitals, island-based hospitals, which was why we appointed him, which was really great. And he's talked about some solutions that aren't necessarily bed as the answer, just add this bed. It's more, these are actual operational efficiencies within your flow.
Because of course what your operational plan says is actually we should be doing as much as we possibly can to make sure that patients can be treated in their own homes.
Yeah, absolutely.
Which, I mean, it almost goes without saying, people are going to feel more comfortable in their own home, provided they know they're going to get the quality of care they need. But obviously all these things require
Phil,
change.
Just to give you like one example. So if you get referred to a department within the hospital, or the urgent care area, as opposed to the accident emergency, they're having to come through the A&E, and that whole patient experience is adding hours to that patient experience when they could be going directly. So we need there are efficiencies that we can start to implement. Those things could be really quick to actually make that pathway a lot quicker, get them out of that A&E area. It is accident emergency, and really make that work as an accident and emergency area. As I say, we'll publish the bed review, and we'll go into more detail about what those solutions are. But a lot of them have come from those consultants. And this is about, talking about how we can change and bringing people along with us. That's why I wanted to do this, because it was independent, number one. They don't, this person doesn't have any, anything to any axe to grind with anybody here. There's no, there's no alliances anywhere. It's basically coming in, what can we do to make this work a lot better? And I think hopefully that will absolutely show that we've listened to what the consultants have said, and we've acted, and we've absolutely, hopefully, will bring them along with us, and we can start to see those changes.
And one of the reasons I mentioned playing politics is, of course, consultants particularly get to see an awful lot of people. There was one consultant who will remain nameless, who didn't know that I work for Manx Radio, didn't know I make political programmes for Manx Radio, who was telling me that the medics at Nobles are deeply concerned about the whole structure in which they operate, that there's far too much bureaucracy, there's far too much paperwork, and that's what they're saying. And I guess if he said it to me, he's probably said it to most of the people that have come in, because I wasn't fishing for information.
I mean, I'm not sure what examples he might have given you, but it's digitally, we really need to enhance things within the organisation. I've spoken about this before, in the sense that, you as a consultant or as a medic, you're working on within a ward, you have to log on to 7 different systems, and it's a paper-based system.
And actually, that was one of the examples he was showing me.
Brilliant. So that's back to the Manx Care record. I mentioned that earlier.
And I suppose
really important.
The frustration that person had when they were having the conversation with me appeared more to be that they didn't feel that if they went to Manx Care they'd be listened to. I mean, what would your message be to anyone working at Nobles who felt like that? I would say, please don't feel like that. Again, it comes back to communications, that we need to say and make sure that they know what's happening from our side in terms of to improve those situations, and
and I would say, feel absolutely you should speak to because they can communicate that to them. If you speak to your line manager. I don't think raising something as in terms of bureaucracy or sort of digitally, I don't think that's going to cause any sort of concern from management to sort of speak to somebody about that.
I mean, is there a kind of the equivalent of a whistleblower policy whereby if someone feels that they're not being listened to by the person they should go to, that there's some other route for them?
Yeah, totally. And, every department has a whistleblowing officer, but you can go to any whistleblowing officer in any department. So you could come to the DHSE whistleblowing officer if you wanted to, if you were nervous about that, and they would deal with
because you can, I suppose, understand sensitivity from people who are in reasonably senior roles. And obviously they don't want to rock the boat because they rely on the job they've got. They want to improve, but they feel that they're hitting a brick wall when it comes to the suggestions they're making.
Yeah, I think you're right. I think if that's how they do feel, my message to them would be definitely approach a different whistleblowing officer. It could be the whistleblowing officer in the desk, for example. I think that would hopefully alleviate some of those concerns. I think there has to be some, Julie Edge is obviously that report, the whistleblowing report. I come from the school of, I really sort of feel that we should have an independent whistleblowing committee. I think that, I know that would be costly, Phil. I know, when we do these things, when we take things and make them independent, but ultimately, would it not be more beneficial for the individuals to have that independence and security? Would things happen quicker because it's not somebody's kind of other role, if that makes sense?
I suppose, it must be a worry for you to know that there are people working for your service that feel that way. And again, you talked about cultural change, and one of the things you were really keen to do amongst officers, the officers you had direct contact with on a daily basis, for them to feel that actually there was open doors and all the rest of it.
That's a massive cultural change to say to all staff that, certainly as you say, that come into contact with me, you can talk to me, and but I'm the one that is accountable. So if something is going wrong, just because you're telling me that something's going to go wrong or something has gone wrong, whether you can't deliver on something, whether you've missed a deadline for a report or something like that, it's really important. I can't solve it if I don't know, and I'm quite, if I see how hard the DHSC officers work, and I see how hard consultants across the board work, I will go out there absolutely and say, you know what, we've done our best to hit this deadline, we've done our best to deliver on this, and we've not been able to, but we're doing X, Y, and Z. And I will take that, because that's the most important thing, not the officers, not Manx Care. That lies with me. And that, what that does is that hopefully means that culture of finger pointing dissipates, and that they can feel confident about stepping up, because they've got somebody who is basically saying it's okay, or let's solve the problem. If you tell me earlier enough, actually we might not get to that point. We can actually solve it and resolve and make it a lot better organisation.
And that has to be a better way of working.
That's what every place I've ever come from, in terms of people that kind of sort of only know me for owning a clothing store here on the Isle of Man, but my bigger background, I worked in Burberry for just under 10 years, and that was the leadership style, and it encourages people to step up, and it encourages people to say, hey, do you know what, something's going to go wrong over there, it's not my area, but I can see it's going to go wrong, and how can we help, and what can we do? And that we don't have finite resources. We should be able to deploy staff into other areas to say, this area needs support because they're under a great deal of pressure, and that just shouldn't just happen within the DHSE. We should be able to do that across government. on the wider scale, because we did that during COVID, didn't we? And we did it really well. And look at how much efficiencies we made by deploying people to different areas when things were really, at a critical point. Well, actually, sometimes critical points happen even without a COVID scenario, and we should be able to, but we can't, because we're not one government. It's not, we have this single legal entities, and that's something else that I find illogical.
Well, Minister, sadly, that is our allotted time up.
It's the best hour of my life, Phil,
yeah.
thank you.
That was Douglas South MHK and Health Minister Claire Christian. So what do you think? The recent overspend headline suggests that little has changed, but the Minister seems to have a plan to get finances back on track. Is 18 months long enough for the Minister to effect the significant change many people suggest our health services need? I'm Phil Gaughan. Go to Thanks for listening.